Good evening and thank you for joining us. Just when it felt like we were in the clear, another heavy snowfall has walloped Thunder Bay and the surrounding area.
It knocked out power to about 9,000 hydro customers and also forced a number of highway and facility closures, Vasilios Bellows reports.
Synergy North repair crews were busy across Thunder Bay as the wet, heavy snow led to various power outages. Close to 2,000 local customers were affected at one point, including a brief power interruption at the Thunder Bay Regional Hospital. The nearby Health Sciences Center building was also impacted, with some clinical services forced to be rescheduled. Along with this, Lakehead University and the Nanabeju Child Care Center on the property had to shut things down after they too lost power in multiple buildings. Public relations with Synergy North Christina Grew says as power was restored in one location, another outage would pop up.
It's definitely been a busy one. It's all hands on deck between our crew working as safely and as efficiently as possible. Our operation system control, our customer service team. It's just an evolving situation with the storm and the weather.
Things were even worse in the outlying areas as Hydro One reported over 90 outages and 7,000 customers without power, many of them until Thursday afternoon. Meanwhile, there were several highway closures around Thunder Bay, the most significant being between Maple Ward Road and Sistinen's Corner, and between Kakabeka Falls and Shabakwa. The Highway 102 closure caused a backup of more than 50 vehicles just before the lunch hour. Thunder Bay schools were also feeling the effects of the cold weather, with rural schools closed all day and both the public and Catholic boards ending classes early in the afternoon. Vasilios Bellows, TBT News.
Dawson Road was a hot topic at City Hall this week. Council has instructed city staff to explore additional safety measures along the roadway. The call comes from a memo from Councillor Mark Bentz seeking other options with the designated truck route still deadlocked. Corey Nordstrom has more.
The request from Councillor Mark Bentz focuses around the high number of incidents involving tractor-trailers on Highway 102 and Dawson Road. He asked that administration look at speed restrictions, signage and road design consideration, additional turning lanes, and to work with the Ontario Truckers Association and MTO to improve training.
In light that the DTR is not moving forward, I'm sure the users of that road would appreciate council doing a fulsome review of any and all issues that would address their concerns.
Bentz's motion passed, though not by much, with a 7-5 decision. The two most vocal opponents being Trevor Gertuga and Albert Aiello, strong supporters of the designated truck route as a way to make Dawson Road safer.
That's not what the residents want. They want the issues cleaned up around County Fair, those intersections. You know, they don't want further speed reductions. This isn't asking what they want, and I'm sure Councillor Aiello will probably talk about the same issues.
It seems like this is more of a make-work project, really, for administration. I believe they've done it as best as they can, but without having a designated truck route. The road is the road.
Will this be in our top 5 or top 10 issues?
We believe that we have done quite a bit to try and address what we can. Again, there might be some minor things that we can do, and I don't know what the improvements of safety that might make. But as I indicated, we do have a lot of other priority items.
Though it wasn't all criticism from the two most vocal opposition.
I've heard from a lot of truckers that are truck drivers, that people are not getting the level of training. They don't know how to deal with icy situations, with rainy situations. So I could support that part of the resolution.
Proper signage on the route and the yield sign are two things that would definitely make a difference.
Administration will present the completed report to Council on August 9th. Corey Nordstrom, TBT News.
A Rocky Bay First Nation man has been sentenced to 6 years in prison in connection with a murder at a Thunder Bay hotel 2 years ago. 38-year-old Dennis Terry Bernard pleaded guilty to manslaughter back in February. Bernard was one of 3 people arrested by city police following the stabbing death of 29-year-old Paul Vivier. It occurred at the former Midtown Inn on Cumberland Street in May of 2020 and was motivated by a drug debt. Bernard has been in custody since the incident and was handed his sentence today. With credit for time served, he'll spend another 3 years in prison. Meanwhile, another murder trial is underway at the city courthouse for 25-year-old Jonathan Yellowhead. He's accused of manslaughter in connection with the death of 17-year-old Braden Jacob at Chapels Park in December of 2018. That trial is expected to last 2 weeks. Full details about the testimony can be found each day on tvnewswatch.com. The COVID-19 situation is status quo today at the Regional Health Sciences Centre. There's no change to the number of COVID patients being treated there, but there's a big change coming to the way the Northwestern Health Unit reports cases in that part of the region. There are still 19 people being treated for COVID at the Regional Health Sciences Centre, with 8 of those patients in intensive care. Both of those numbers are unchanged since Tuesday. The hospital's overall occupancy rate is now just less than 103%, while the ICU's occupancy rate has fallen below 91%. The Thunder Bay District Health Unit is reporting 62 new cases since Monday, and there are 127 known active cases. However, all case counts across the province are believed to be an underestimate due to COVID-19 testing restrictions. The latest incidence rate from last week showed 128 cases per 100,000 people, and the test positivity rate dropped just below 13%. In the Northwestern Health Unit, there are now 172 reported active cases. 120 of those, or 70% of the total in the NWHU, come from First Nations reserves in the Sioux Lookout area. The health unit's 7-day test positivity rate is now 15%. And the Northwestern Health Unit is now changing its COVID-19 reporting schedule. It will now only provide new case information once a week on Wednesdays.
If you're 60 or older, you'll be able to roll up your sleeve for a 4th dose of the COVID-19 shot as early as tomorrow. The province has announced a plan for the next round of booster shots. The 4th dose will also be available for all adults in First Nation, Inuit, and Métis communities. Scott Lightfoot has the details.
People head into this East York vaccine clinic this morning with news that a 4th dose will soon be available for Ontarians over the age of 60.
Well, I'll be getting one for sure. Any measure to keep away from COVID, I think, is good. So, yeah, I'll be ready to go on Thursday.
They tell us that the vaccines, they don't last too long. After 6 months, you have to have the another one. You see, so naturally, I am waiting for the 4th one.
That wait will end tomorrow when the province says people over 60, as well as First Nations, Inuit, and Métis individuals and their family members who are over the age of 18 can start booking appointments.
And they can start booking appointments as of tomorrow through the usual vaccine portal or calling the phone number, as people always have. So that's going to be really important for people to get that extra level of protection.
The province says eligible individuals can get their 4th dose 5 months after they received their 3rd dose.
The benefit of this 4th dose is likely not going to be as significant as the benefit of the 3rd dose, but there's probably some benefit based on the data we have to date. Of course, we have to timestamp every conversation because we don't have a full picture of, the best data right now. But anyways, I think it's fair to say that a 4th dose will be beneficial for people who have the greatest risk of hospitalization.
Ontario has been offering 4th doses to residents of long-term care and retirement homes, as well as select immunocompromised individuals for several months.
A motion from local MPP Judith Monteith-Farrell passed unchallenged at Queen's Park yesterday evening. It calls on the government to immediately develop and implement a strategy to address Northwestern Ontario's physician shortage.
Over 7,000 plus hours of locum coverage have been requested by physicians across the north for March 2022 alone. The most since the pandemic was declared 2 years ago, and in fact, the most in the history of the emergency department locum program. We need short, medium, and long-term solutions to ensure that healthcare needs of Northerners are taken care of. I completely agree with Dawson. We need solutions.
An increasing dependence on locum doctors who are brought in from elsewhere to cover local shortages was only one of many issues raised by Monteith Farrell. Other NDP members added their concerns, including Kiiwetinoong MPP Saul Mamakwa. He spoke about the recent ER closures in Red Lake and inequitable health care for remote First Nations. Monteith Farrell called for better training and recruitment, streamlined licensing for internationally trained doctors, and a unified retention strategy. Conservative MPP Norm Miller says his government will support the motion and listed several healthcare initiatives already announced by the province, like the recent increase of med school spaces.
Government is already saying yes to better health care in the North after decades of neglect from the previous government. Ensuring access to care wherever you live is something the government takes seriously. As someone who represents a riding that spans from the central Ontario to the more rural North, I understand the unique healthcare challenges present in all northern communities, not just the Northwest.
Monteith Farrell agrees that previous governments are responsible for the current situation, but she insists more has to be done by this government to address the immediate need.
A shocking loss has rocked the classical music world. Celebrated Canadian conductor Boris Brott, who led the transformation of the Thunder Bay Symphony as its first music director from 1967 to 1972, has died after an alleged hit and run in Hamilton. Police in that city say Brott was struck by a vehicle on Tuesday morning. Brott was an officer of the Order of Canada and the Order of Quebec. He founded the National Academy Orchestra and the Brott Music Festival. Friends say he will be remembered for many things, but especially for his ability to connect with people.
He was not a distant, austere figure on the podium. He was the opposite of this. And that's how he built a career that won't be forgotten.
Brott was 78. He's survived by his wife and their 3 children. The driver fled the scene and was arrested a short time later.
A local prayer service was held last night at the Ukrainian Catholic Church of the Holy Cross in support of people in Ukraine suffering through the Russian invasion. People packed the church in solidarity for a service to the Mother of God for peace and freedom. It's been an emotional month and a half, and the special service was another chance for the local Ukrainian community to come together. Pastor Stepan Deduer says there were a number of attendees from outside his congregation, proving that people are united in opposition to the atrocities they see in Ukraine.
We don't have power, we don't have money to buy any rockets for defense, but we can pray, for our defenders, for all those people in Ukraine who are suffering, and also to pray even for Russians in order to soften their hearts.
Deduer believes that powerful countries like Canada aren't doing enough to help Ukraine and hopes the show of support from so many spurs additional action.
And of course, we'll have more on the situation in Ukraine.